Swelling in the legs and feet during pregnancy is incredibly common, but is this normal? And when is it something that someone needs to be concerned about? My name is Kelly. I'm a physical therapist and a certified lymphedema therapist that specializes in swelling and edema. I also happen to currently be about 7 months pregnant at the time of recording this video, so I am putting together a series of videos about swelling management during and after pregnancy that will be in a playlist on my channel. So be sure to subscribe and follow along to see when all of the videos are released this year. But today in this video, I'm going to explain leg swelling during pregnancy and when is normal and when it's not, and it's time to seek medical attention. Before we jump in, it is always best to check with your doctor or medical provider to get clearance for any new changes. But in this video, I'm going to share generally what we look for with swelling during pregnancy to know what is normal, what is not. Swelling occurs in pregnancy for various reasons, and often this is normal, and thankfully it does not cause harm to you or the baby. First, there is an increase in blood volume that your heart is pumping that occurs for the body to keep up with the demands and support for the baby or babies with pregnancy. The body also tends to have more fluid retention throughout the body, starting usually in the second trimester and then definitely progressing further into the third. There is also the potential for more restriction in blood flow from your legs back to your heart because of the congestion that occurs in the pelvis and abdomen with that growing baby and the lower amount of space that that fluid and that blood has to move through. So this all typically causes mild swelling that is worse in the evenings after someone has been upright or on their feet all day, and it's usually better in the mornings after the legs have been elevated all night. Now, if we look at things that are not typical or not normal swelling responses during pregnancy, one thing to look at is if there's any rapid swelling that comes on quickly or severe swelling, especially in your face, in your hands, maybe in your feet. It's incredibly important at that time to contact your doctor for health and safety reasons because this can be caused by other various medical issues such as preeclampsia. So preeclampsia is a condition where there is very high blood pressure and an increase in protein in the urine, and this can cause that swelling. The direct cause of preeclampsia is somewhat unknown, but it's thought to be related to an issue within the placenta. Other symptoms to watch for this condition are severe headaches, vision changes, and then shortness of breath. For any and all concerns, it's important to reach out to your doctor right away. Another serious condition that can cause swelling in the legs during pregnancy that's not normal is a blood clot, which we also call a DVT. Women who are pregnant are 5 times more likely to have a blood clot compared to a woman who is not pregnant. Why is this? Again, a potential reason is that blood vessels may be more restricted in the pelvis due to that growing baby, causing lower blood flow in the legs. Also, when the body gets ready for delivery, the blood may thicken to prevent a significant increase in blood loss during delivery. So the body does amazing things during and after pregnancy, but unfortunately, there are a few risks with these changes, including the blood clot risk. Signs and symptoms of a blood clot when compared to general or mild swelling sometimes it's confusing to know which is which and what is normal, what is not. But one thing to just start to look out for is that with a blood clot, yes, you have the swelling, but you may also have pain and redness in the area with that swelling. When you have mild swelling that comes on, again, worsens throughout the day and then gets better in the morning, that mild general swelling, that's usually pretty equal on both legs, unless someone has had a chronic condition they know of before, versus a blood clot may just be on the one side that the blood clot is on. So if there's a difference between the two, there might be pain involved, redness involved, and those are all signs that it could be a blood clot, and then to reach out to the doctor. The swelling with a blood clot usually comes on quicker. It may be more severe on that side that has the blood clot. It may not change from morning to night. All of those things may be different. The most common location to have a blood clot in the leg is in the calf region. So although that's not the only place they can show up, that is what we see the most often. So again, we'll sometimes squeeze the calf muscle if it's really tender with that swelling. That could be a sign of a blood clot, and again, reach out to the doctor. But if that blood clot travels or is able to travel up the body and back to the heart, it can travel to the lungs, and someone may have a significant shortness of breath too, and that's another sign of a blood clot. Now, yes, this can be challenging to detect as many women already have shortness of breath when we're pregnant, but that is why it's important to monitor for any changes and to continue to communicate with your doctor. General and mild swelling can be normal and treated in simple ways, which I go more in depth in a couple of my past videos, and I will link these in a playlist up above that you can check out. But for more information and content related to swelling and edema management in general, you can check out the rest of my channel and the swelling and pregnancy playlist for more specific content. But other than that, I hope this video was helpful, and we'll see you all in the next video. Thanks, everyone.